Thank you. Right, we've been promised another fine weekend this weekend, haven't we? And if so, you might be well tempted to go out for a stroll in the countryside. But if you're out walking, you need to be aware there is potential harmful hazards lurking out there in the form of ticks. And there's one woman from South Yorkshire who has first-hand experience of this. Wendy Fox from Wath contracted Lyme disease as a result of being infected by ticks. It left her blind and in a wheelchair at the age of 23. She now campaigns to warn other people of the dangers. She's been telling me exactly what Lyme disease is.
Lyme disease is a bacterial infection. It's caused by a bacteria called Borrelia, and it's carried by ticks, which can also carry other infectious pathogens as well. So if you get bitten by a tick, you can get Lyme disease and other infections at the same time.
When did you first realise that you had got Lyme disease?
Well, I'd been ill for quite a while, and the doctors couldn't find anything wrong with me, and I was deteriorating. But I was in a high-risk category because I grew up on a small holding. I did equine sports, and I was a zookeeper. And then a very forward-thinking infectious diseases consultant at Sheffield suddenly realised what it could be, and he tested me, and it was Lyme disease, and I was admitted and treated straight away.
How did you feel when it was diagnosed? Were you aware what Lyme disease was?
No, I didn't know at that point that ticks in the UK could carry any. I mean, I knew there were tropical diseases that you could get from ticks, but I didn't know British ticks could carry any infections at all.
How likely is it that people who go out, say, walking can get this type of thing?
Well, the more outdoor pursuits you're involved in, the higher the risk is. Ticks, there are areas where the ticks are more prevalent, but the problem is that now not only have tick numbers increased, but their density, their distribution has increased as well. So there are more ticks where there used to be none, and a higher percentage of them seem to be infected than before as well. So the sort of average is about 1 in 3. So if you go into an area where there are lots of ticks, that you are at a greater risk. But there are simple precautions that you can take.
What kind of precautions are these then?
Well, dressing appropriately in the first place is very sensible. Tucking trousers into socks and using clothing with elasticated wrists and waistbands. This helps to prevent the ticks from actually getting under the clothing. And using a repellent as well. DEET-based repellents are the most effective. But if you don't want to use a chemical repellent, there are non-chemical alternatives available, but DEET is the most effective against ticks.
Now, I've kept horses and I walk dogs, and I've had ticks on horses and dogs. What is the advice then to removing these particular ticks? Because that's the reason why you probably got Lyme disease, is it?
Absolutely. How you remove a tick is crucial to preventing disease transmission if the tick is infected. The way that I was taught to remove them was to burn them off, but burning or smothering them in substances such as petroleum jelly or nail varnish and that sort of thing actually can cause the tick to... They will release, but before they release, they can regurgitate some of the stomach contents, and the infectious organisms are in the intestines and in the salivary glands as well, so that's basically inoculating you with any infections. So removing a tick correctly is very important. The only two safe ways to remove them are either with fine-tipped tweezers used from the side so as not to compress the body of the tick. And you shouldn't twist with tweezers either, because it exerts too much pressure at the mouth parts and they can break off and remain in the skin. And the other safe way is to use a tick removal tool as well, and our charity supplies these. There are various ones on the market, but some of them aren't as safe as other ones, so we supply the one that has performed best in studies. Well,
I've done the tweezer thing, so I'm okay. Sadly, getting Lyme disease has left a huge effect on you. How do you cope?
Well, I have to remain philosophical, and I don't blame the doctors in not being able to diagnose me, because Lyme disease is very difficult to diagnose. The symptoms are very non-specific. There's only one symptom that's very specific to Lyme disease, and that's an expanding red rash called an erythema migrans, but only about 50% of patients actually present with this. And aside from that, it's just general flu-like symptoms, aches and pains, so it's very hard for doctors to pinpoint what's wrong with you. My disabilities caused by Lyme disease make my life very difficult, but I'm very lucky that I've got good carers, a very supportive husband and family and friends. So my main goal now is to make sure that other people don't end up in the same position as myself.
Do you think the dangers of Lyme disease get enough publicity then?
Awareness is growing, and that can only be a good thing. But I think there are so many sort of scare stories in the media, and so I think it sort of washes over them. But, the thing about Lyme disease and other tick-borne infections in the UK is that there are no vaccines to prevent them. So awareness is the best defence, and we certainly don't want to put people off going out and enjoying themselves. In fact, on the contrary, we want them to go out, but to go out in increased safety.
Now, if people want further information, what should they do, Wendy?
They can visit our website, which is www.bada-uk.org. That's BADA-UK.org. We're always there to offer advice, and we've got a very comprehensive website. Plus, we supply tick removal tools and repellent products as well.
Wendy Fox, thanks very much indeed for talking to us on BBC Radio Sheffield.
Thank you.